I understand the point of in the framework of the emergency that we're in right now. Government can invoke police powers, they can invoke emergency powers, and so on. But what I was fascinated by was the thought of the new normal emerging from this. Let's say we're past all of this, and you're saying we've seen the flaws of devolution and so on. That's what I'm trying to see. What do you see beyond this as far as local government code is concerned? Can we can we use that, take leadership to make it synchronized as possible, or do you actually need to tweak it, or do you see a hybrid system of some sort?
I think, well, personally, I have always believed that healthcare shouldn't have been devolved in the first place, and this is just proof for me. But if you're looking at it, then maybe we can do a how would you call it, a graded renationalization. For instance, rather than in total just renationalizing the entire healthcare system, because that's going to be difficult, and local government officials will definitely refuse that because it will entail loss of some income from them or resources. For instance, why don't we renationalize all of our health personnel so that they all so that we can reallocate where we need them, and pantay-pantay lahat ng health personnel natin. Hindi siya umaasa sa local government. And your health personnel has that independence of saying, look, this is what the DOH is saying, this is what we need to do. Ganon. Hindi siya tali sa local politics and local situations. At the same time, your health personnel becomes insulated from changes in political fortunes within the local government. Kasi nangyayari ngayon, pag hindi ka gusto ng mayor o bagong governor, pwede kang palitan. So, nangyayari yan all over. So, I think that's the answer for you, Robin, na we may not be able to renationalize the entire healthcare system in one go, but the fact that we are seeing now problems engendered by devolution means that we really need to address that squarely. It used to be an elephant in the room. Every time we discuss health policy, healthcare, just nobody, because it was taken as a given. But now we see that it's working against us. And it's not just the pandemic that's revealed it. It's just the pandemic just aggravated the problem that's already been there for the longest time.
Okay.
But Doc, do you see anybody in government moving in that direction that you're saying right now? Basically, is it even on the table? Is it even on the table? Is it even being discussed?
I think there has been legislations in the pipeline regarding renationalizing the healthcare system. Again, it's caused a lot of there's been a lot of obstacles because again, local government officials will simply not agree to it because when the healthcare system was devolved, a big chunk of the national budget was devolved to them. But now we're seeing this problem. So one of the measures, I think one of the intervening measures that government can do is to make sure that kasi there's compulsion or compulsory
mandatory
local government local government are not compelled to spend the devolved funds to them on healthcare. So they can actually underspend on healthcare. When in fact, they should be spending
they can shift
that much for Yes. So walang ganon eh. If the national government can compel local government to spend 15 to 16% of their ERA on healthcare, that becomes a big thing. Right now, we're spending what? Between 9 to 11 ang baba-baba. So hindi talaga nakaka-invest. But again, that's only a temporizing measure. We really need to address the problem of how devolution can be addressed, given that it is showing itself to be a problem when it comes to nationwide health problems like a pandemic.
Pero sasabihin ng mga LGU, bumabagal nga daw yung mobilization nila under national control eh. In fact, pati itong vaccine procurement, nagrereklamo sila. Well, not all of them will say it openly, pero yun ang sinasabi nila, mas mabilis daw kung didiretso na lang sila ng procurement nila.
Yes. But also, tama po yun.
Ngayon eh.
tama po yan, Ami. Pero that's always been part of the other side, the other position. Bakit may bibigay sa DOH yan? If DOH itself is not functioning well, if DOH itself has its own problems. Well, for me, the answer would be if you renationalize it, you're only holding one agency accountable. Without that, you have to hold all of these LGUs accountable, different LGUs, and you may have an LGU right now who is that is functioning well, that has put importance on healthcare, but a few elections down the road, magbabago na yung priorities ng LGU na yon. And yun yung problem. The whenever a new
don't you also have a premise there? Don't
Yeah.
you also have a premise there of a very effective and very efficient national government? Because a lot of people
that
are now, on the other hand, if you
That's
think
right,
about
that's
the
right,
imbalance
that's right.
of local governments, you put it in the context, right now, if you put it in the context right now of the DOH having full control of all of the entire workforce, a lot of
That's
people
right.
are very skeptical with the current dispensation.
All right, that's a good point. That's why devolution doesn't just mean that it's not a single act. No? Parang what we are saying is we really have to overhaul the DOH
Mandate
at this juncture.
I think
We
you should
really need to
mandate
overhaul.
it,
Well,
the
not just the
healthcare,
mandate,
yeah.
ano, some of the DOH yung mga bureaus niya is not working in consonance with each other. So the DOH itself has a lot of problems. As we can see it now, kahit sa data management nila ng COVID data, hindi nila maayos isang taon na. No? So maraming problema ang DOH itself. So my answer, Robbie, would be, even if we push for devolution, we need to make the DOH more effective. And that is part and parcel of reversing devolution. But we have an experience now. If you look at the way the DOH is functioning, it's already relying on just deployment. What do I mean by that? You have local governments who don't have enough doctors and nurses, and the DOH is already deploying, is sending nurses
Health
and doctors to
workers
these
from
areas.
other regions.
Yes.
Yes.
Well, even its own health human resource development program
So,
and plans are anchored on deployment. Now, you have a nurse deployment program, you have a midwife deployment program. Even the Universal Healthcare Law, yun ang nakasulat doon. Deployment pa rin. Walang development of local government health workers from the grassroots up to the national level.